This is our side view of Josh on his bike here. One of the big things I look at is posture right here of the trunk. And if you remember, I did kind of point that out before, how he's just really rounded here, and I'll show you in a second just how significant that looks. So let me play this for you here so you can kind of see a little bit. So he's pretty stable here. He's not really moving a ton as he's pedaling forward, which is good. He's not bouncing up and down at all. Just ignore these for right now. So he's not bouncing up and down, and we can see from the other views that he's actually getting more side to side movement. You can see it slightly from this view, kind of if you watch the Trek logo here on his jersey, his sweet linear sport jersey. You can kind of see that he's shifting a little side to side. But what I want to point out here, if I get it lined up. So this line is essentially a little bit more where you would want to see his trunk and his back kind of line up with it. And you can see how he's really rounding up over that line. He's not hinging much here, so you can see down lower on the pelvis, he's really rounded there. And what you want to see is kind of a nice hinge where you have pelvis and then the spine will hinge a little bit, and he doesn't get that. Instead, it's very flat through here and very rounded. So a lot of that comes down to how well his back is moving, how well his spinal segments are moving, and the muscles in the back and then into like glutes and hips. So ideally for him, he would need some, significant hands-on work to really try to get better mobility to even get that position. He really struggles to even get along like a straight line here. So that's part of it, and he does get back pain. So this area here is the area that we're a lot more concerned with, because when he's rounded like that and you spend so much time in that position on the bike, it really stresses those structures like your discs and can put you at risk for like a disc herniation or bulging disc, which would ultimately put pressure on your nerves. So that's one thing that we definitely want to fix on him, and even like head alignment here, so his neck isn't so angled up, and then his neck wouldn't get so tight. If I bring him back a little bit here, kind of looking at knee flexion, so he actually, let me pull this up here for a second. So he's got about 34 degrees of knee flexion here at the bottom, which is pretty close to the normal range. We could maybe raise him up slightly and cut that down a little bit, and that might help with some of his knee pain issues as well. But he also has, if I bring you through here, there we go. So looking at the hip angle, it's got about 117 degrees. So it's not bad, but he's a little limited here, and a lot of it comes down to posture with the pelvis. So because he's not hinged, he's also not getting as good of hip flexion. So the leg's coming up, but the hip joint is kind of jammed and he's not getting enough. So potentially raising him up slightly might help a little to open that up, and give him some more space, and that might also make him more stable on the bike saddle as well. So those are just a couple things looking at with posture and alignment, and really how you're moving on the bike. He's been fitted. The bike is set up appropriately with fit for him, but now it's kind of looking at some of the body mechanics and alignment issues that he might have some restrictions at, or even like neuromuscular stability and control of the muscles while he's on the bike that are really creating problems for him.